fasting as a cancer treatment, myths or breakout on oncology. Over to you, Dr. Taur Rahman.
Thank you very much. Assalamu alaikum, everybody. I welcome all of you in this Ramadan fasting series. That first time fasting in connection with the disease prevention and treatment, both are covered in these webinars with the intention of innovative approach or updated new evidence being shared, like last time when I talked about intermittent fasting and the effect on cardio-metabolic indicators indicating towards the positive connection and association between Ramadan fasting or intermittent fasting and cardiovascular health or cardiometabolic health. I'm sure you heard about the benefits of the fast in relation with the weight loss mainly, but in today's webinar, I will try to reflect upon and share with you some emerging evidence on fasting as cancer treatment, whether we call it a myth or a breakthrough in oncology. Let's see in coming slides. So as we are now walking through, this concept as fasting as a potential strategy, it means it's not conclusive. Potential means it has promising future in the direction of treatment of or as a part of treatment of anti-cancer therapy. Definitely, you know about the metabolism. Cancer, diseases like cancers, hypermetabolic conditions do affect the metabolic route, and it bypasses the normal route for glucose metabolism, protein metabolism, and fat metabolism. And the current evidence supports its role mainly as a complementary therapy, like adjunct. We also call it adjunct therapy. It's not, primary. You can see it's not a primary, therapy that can change the fortune of cancer patients. However, with the cancer therapy, other therapies, chemotherapy, radiotherapy, it has effects. We have seen, and the paper published in the journals like Nature about autophagy, I will share in slides, where they reflect upon that the fast, every hour of the controlled fast is a step forward, strengthening resilience against cancers. It has both direction from resistance against the toxicity of the cancer treatment, both ways. It's like a two-edged sword. Cancer therapy, which includes surgical therapy, radiotherapy, radiation therapy, or chemotherapy, it is very toxic. All the therapies are cytotoxic, hepatotoxic, nephrotoxic. So fasting, as per we have this preclinical data from animals, that is proving some association that it will minimize those toxic side effects of cancer therapy. On the other side, it can improve the effect of therapy, chemotherapy, in positive direction, in killing or damaging, like DNA damage will increase. How it will increase the sensitivity? By damaging the cancer cells and the DNA of those cells. So in one way, it will decrease the chemotherapy or the radiotherapy toxicity effects. On the other side, it will improve. According to the latest, it might improve, according to the latest evidence, it might improve the efficacy of chemo and radiotherapy against cancer cells. So we have this big challenge of cancers, and there are a lot of therapies we are talking about in the past many decades. So it's a good time that we have a new idea while Ramadan month is celebrated in the Muslim world. So why not to take and talk about the benefits of fasting with relevance to cancer and cancer therapy. So that is the main objective of today's webinar, and my talk is mainly for scientific professionals, and there are good news for cancer patients for future. Like I cannot talk about all these the points that I am now showing you on the slides, but mainly I want to focus on autophagy, role of autophagy. Autophagy, if you read more about this, recently in 2019, if I'm not wrong, the Nobel Prize winner from Japan, the scientist from Japan, he won this prize because of the sharing the evidence about autophagy, fasting and autophagy, and then its effects, positive effects on dead cells. Dead cells are dead mitochondria within the cells or other organelles, which are weak, which are dismembered. So the cells, when they are experiencing starvation or fasting, structured fasting, regular with a regular period of time, the cell starts eating its weak and sick organelles within itself, like mitochondria, like other diseased, particles within the cells. This is called autophagy. And with, the process of autophagy, it helped this scientist to win the Nobel Prize. Now we are having a lot of hopes that the role of autophagy, it not only protects the normal cells, but at the same time, it increases the immune system and it increases the resilience in the normal cells. It actually, at the end of the time, at the end of some period of fast, it actually rejuvenates and resynthesizes the cells, the cell structures, the cell functions, and the cell formulations. It appears in the study that after the fast time period, with the help of autophagy, the cells actually, they regenerate, they regrow, and there is a process of rejuvenation. And if there are cells which are gonna be, or they have a potential to become cancerous in coming future, those cells are being eaten by inside the system after autophagy, with the help of autophagy. So in that direction, what we are now hoping that it can prevent, or it has a potential role in various types of cancer preventions. Then Warburg effect, this has an impact on cancer cell metabolism. Like fasting will reduce the glucose and IGF-1 levels, potentially limiting tumor growth and improving treatment response. The cells, all the cells, they need glucose to grow, to multiply. The mitotic cell division, or any kind of cell division, or any kind of cell regeneration or synthesis, it needs glucose, it needs a substrate, it needs nitrogen. So with the fast, the impact of fasting is is promoting gluconeogenesis, like the stores of glucose in the form of glycogen and liver, they are exhausted, and it will reduce those reserves, and definitely the cancer cells will be deprived of that required energy, that will stop their progression by this way. Now, quickly, I will go through this stress resistance in the normal cells and enhancing chemotherapy. I already told you about this, that in one way it improves chemotherapy effect against cancer, and the other benefit is it reduces the cytotoxic effects of chemotherapy. Fast is two-edged sword in cancer patients when there is a cancer. As I told you, it's animal studies, in vitro studies, preclinical models suggest fasting may reduce tumor growth and enhance treatment response, but consistent clinical benefits in humans remain unproven. So there is more to be, researched and extrapolated about cancer. Tumor growth reduction, as I told you, it restricts tumor glucose supply, disrupts cancer metabolism, and may enhance chemotherapy while protecting normal cells. I will take you to, I think, this slide, the potential benefits. Fasting induces a stress-resistant state in normal cells, reducing chemotherapy toxicity, as we discussed before, I think, reducing the side effects, and then induces autophagy. Fasting triggers cellular recycling mechanism that clear damaged organelles and proteins, including dysfunctional mitochondria and cancer cells. Again, I told you about this in the beginning. It modifies the tumor metabolism, and cancer cells depend on glucose for survival. Fasting deprives them of glucose, disrupting their metabolic pathways. And this last point, boost immune response. Animal studies like rodent studies show increased activity of natural killer NK cells and cytotoxic T cells during fasting. So it has a positive effects on the immune system. It improves or boosts the immunity in the animal studies. So hope this has the same effect in animal study, but in human study, but still we are waiting for those studies. So we can say, to summarize, fasting reduces metabolic stress in cancer cells, enhances chemotherapy, radiotherapy efficacy while sparing normal cells. And this one also, I think, we discuss. Here, the challenges, we must not forget that when we are talking about fast and the benefits of fast, there are some limitations. For example, patient with cancers, they always they are experiencing weight loss, muscle loss. So there is malnutrition risk. Cancer patients often experience cachexia and severe weight loss. So fasting may exacerbate this condition. Secondly, the data is limited. Human data is limited. Most evidence comes from preclinical animal studies and small-scale human trials. So we are running short of the human data. Mostly it's coming from the animal studies. And it's not a stand-alone therapy. Fasting alone is unlikely. Like, as I said, there is a chemotherapy, radiotherapy, and with that, if we use fasting as an adjunct therapy, as a complementary therapy, then fasting may have a supportive role, but fasting alone is unlikely to induce tumor remission. Tumor remission means patient treatment is successful and patient disease is reversed. Still treatment is on, but patient is now in remission state, means patient treatment is working and patient is now on the way towards the success in the treatment. It may only complement conventional treatments like chemotherapy and radiotherapy. And potential adverse effects. Extended fast, if the fast is prolonged for a longer period of time, it could lead to electrolyte imbalance, hypoglycemia, and weakened immunity. So these challenges and limitations should also be taken into consideration. It is not a standalone therapy. It may work as an adjunct therapy or a complementary therapy. So the recommendation until now, the limited clinical data with some limitations, animal studies are more and more being shared, and we are extracting those data, and conclusion is not, the results are not inconclusive. So what we should do to really, prove some causal links between fast and the cancer therapeutic effects. Clinical trials, we need more clinical trials, large clinical trials, RCT, randomized clinical trials, to validate fasting is safe and efficacious as a complementary therapy. And this could provide robust evidence to support the use of fasting in oncology. So it is a must. Without this, we would say the evidence is limited and it is not conclusive. It is inconclusive. We need more personalized approaches. Fasting regimens may need to be tailored individually, tailored to the individual needs and profiles, including cancer type, stage, overall health. The cancer there are 300 types of cancers. There are liquid tumors, there are solid tumors, there are blood cancer, there are head and neck cancers, breast cancers. Each and every organ has some types of cancer. So we are not sure fast has an effect, but which one, who is who, where it affects and where it affects are not proven, and sometimes it might go in other way. It might go wrong. So precision oncology could integrate fasting as a part of multidisciplinary approach to treatment if it is proven. Combination strategies, as I said, it has a adjunct effect. So exploring fasting in combination with immunotherapies, targeted therapies, or fasting mimicking diets. So uh, we can say that there is promising evidence, emerging evidence, fast as adjunct therapy to the cancers, with the limitation that the studies which indicate towards the positive effects of fasting on cancer treatment, they are actually mostly animal data. So we need to increase the human trials and gather more human data to validate the use of cancer, the use of fasting as adjunct therapy for the treatment of patients with cancer. I think I would not take more time on this. If you have any questions now or later on, I will be available for any type of questions. Thank you very much once again. Over to you, Siddiqa. Thanks.
Thank you so much, Dr. Ataur Rahman, for sharing such insightful knowledge. Now it's a time to introduce our second speaker. Our second speaker is Ms. Amna Iftikhar. Ms. Amna Iftikhar is clinical psychologist at Rambo Obesity and Eating Disorder Center, Evercare Hospital, and she is PhD candidate in clinical psychology. She will guide us through the psychological and behavioral dimension of fasting and mindful eating and a sustainable eating habit. She is going to explain metabolic reset, fasting, emotional regulation, and cancer protection. Over to you, Ms. Amna. Over to you, Ms. Amina Iftikhar.
Thank you so much. Basically, this is like sometimes when we are talking about the metabolic issues, fasting, and somehow the chronic diseases. So many times we undermine the psychological impacts. So thank you so much for inviting me to talk about this important and fruitful topic when specifically we are talking about the prevention, because many times when we are talking about the cancer prevention, so we most of the time focus on the genetic aspects, the environmental aspects, and very much focus on the diet and lifestyle. But unfortunately, there are so many other things which we need to highlight, we need to educate, and even being the practitioners, we have to have a knowledge about this. Sometimes the chronic stress, emotional dysregulation, and the impulsive eating patterns and cognitive distortions leads towards such unhealthy behavioral habits, which can increase the chances of having such chronic disease like cancer. So when we are talking about the prevention, so prevention begins in the brain. So whenever you are focused on your psychological well-being, your cognitive patterns, it is a helpful tool for you to understand the biological and the psychological aspect for such diseases. So whenever a patient come to us and they are like having multiple issues, sometimes they just ignore the psychological factors, and they are very much like concerning about other health consequences, like if somebody have some diet related concerns, so they are very much open. If somebody has some physical concerns, so they are very much open. But many time people are struggling with chronic stress, and they just ignore, because culturally this is a norm. We are most of the time just cope with stress by diverting ourselves, or many times just suppress. So chronic emotional stress usually leads to increase the cortisol levels. And now this is something which is linking from psychological to biological pattern, and how it is important to like slow down the process of those chemicals, so this can help us to prevent the cancer in future. So when your cortisol level increase, definitely it can cause inflammation, it can like suppress your immune system. And whenever a person have poor immune system, so it might be like increasing the chances of having chronic diseases. So with the suppressed immune system, it can lead toward increasing the insulin resistance. So it means that all of the basic hormones a human body need to have the healthy functions. So because of just the chronic stress, this hormonal system got disturbed. So all of these factors are linked to increase the cancer risk. So this is prevention is very important, because management is one thing and prevention is important, because it can reduce the cost of medical services. It can even if it diagnose and identify at the early stages, so it leads toward the good prognosis as well. So always keep in your mind whenever we are talking about prevention. So first of all, we need to know about the factors as well. So psychological factors are important in developing the cancer. So after chronic stress, biological aspects, our emotions are very important to highlight. Sometimes people are even not well aware about their emotions. Sometimes we just cope our negative emotion with some negative behaviors as well. Sometimes they end up on emotional eating. Sometimes they end up on really unhealthy sleep patterns. Sometimes it is leads toward, if you just ignore the stress management, so it can like increase the chances of unhealthy coping mechanism. So why it is important for we need to know about the emotional regulation and to focus on the eating patterns. And if we just ignore it, it can increase the risk of having the cancer, because emotional dysregulation usually linked with the impulsive eating. And impulsive eating, people habitual to have the binge eating, and in binge eating they prefer to have the comfort food. Like some people crave for the sweet stuff, some people crave for the frying stuff, some people like prefer the salty, the crunchy stuff. And whenever a normal person increase the food intake, and basically the junk food intake, so if they compromise their physical health and increase the risk of obesity. And obesity is linked with insulin resistance, chronic inflammation, which can increase the risk of cancer. So here the point to highlight is psychological patterns become the biological risk. So simply when we are talking about the stress, as I mentioned, our coping is just like we park it, we just divert, and sometimes we go for the unhealthy eating pattern or some other unhealthy coping mechanism. But this is the fact, if you are ignoring the psychological patterns, so this can be a risk to like abruptly change your biological functioning. So fasting as a cognitive exercise, because in fasting there are multiple concepts. Basically, being Muslim, it started from the religious perspective, but scientifically proven, this is a scientifically proven fact. Fasting is helpful to regulate the diabetes, insulin resistance, manage weight, and some other like health benefits are also linked with fasting. So if we take a look from psychological cognitive aspects, so fasting is a very helpful and a positive cognitive exercise, because whenever you are focused on your emotions and on your cognition, so this is something which gave you more self control. So self control actually leads toward helping and reducing the overeating cycle, because whenever your mind, your cognition are logical and intact, so it is somehow linked with some controlled and some positive emotions. But if you overthink, if you stressed a lot cognitively, so definitely it will increase the negative emotions as well. So to handle the negative emotions, this is somehow linked with the binge eating and unhealthy eating patterns. And when you control the overeating, so usually people shift toward the more healthier food option, more healthier lifestyle, which help an individual to have a stable weight, to regulate your normal BMI, and to gain some health benefits as well. Whenever your stress levels are low, it helps to reduce the insulin spike as well. And when your hormones and your metabolism is on a regular path, so it can lower the inflammatory burden on from your body as well. So this is very important to notice that self control is a protective health factor. It is not only related with cancer, it is also related with other chronic health diseases as well, because your mind, your brain is actually the major factor. If you feel good, if you think good, if you are having a more good emotional regulation pattern, so your body hormones, your neurotransmitters, they are working in a very effective and regular way. So that's why I always mention, if you want to improve your quality of life, so basically the first thing you need to think about is your emotional well-being, your cognitive wellness. So fasting and distress tolerance have a very helpful connection. So when you do safely the fasting, so it means that it increase your distress tolerance as well, because religiously the fast is about to develop the patience, the sabr. So whenever you develop a control, whenever you develop a patience level, so this is something which increase the emotional tolerance, which in strengthens the comfort endurance, which help you to reduce the impulsive reactivity. And whenever you regain a control over your emotional distress, over your like feeling of being discomfort or feeling overwhelmed, and somehow it will help you to reduce the impulsivity. So this actually improves long term stress resilience, and resilience lowers chronic inflammation. So stress and inflammation link is very important, because whenever you are under stress, so definitely unregulated emotions are linked with cortisol spikes and pro-inflammatory cytokines. Cellular damage risk will be increased. So this is important when we are working on the regulation and the prevention. So you need to regulate the emotions, your cognition, which can help you to reduce the inflammatory load, improve immune surveillance, and psychological stability to protect your body cells. Then fasting, even sometimes if we just ignore the red flags, and fasting is not helpful for all individuals, so it might can be harmful in a way. So if I talk about the risk group, so people struggling with emotional eating or eating disorders, are having the severe anxiety or PTSD, traumatic history, are rigid perfectionism, are having some personality disorders. So even in some cases, fasting can worsen the condition, because people with those issues can restrict their food intake, or sometimes they overeat or binge more. And with anxiety, people have like always a fight or flight mode, which can lead toward some physical psychosomatic symptoms, and this can increase the risk of repeating this cycle and develop more fears in those individuals. So fasting may trigger restrict binge cycle, because it leads toward the self-pity, and sometimes because you are fasting and people think that so all the day are in the fasting window we are not eating, and when they just break the fast, so they binge more, they eat more, they crave more. So this can be harmful, and this can be challenging in many situations. Somehow the other risk factors are the other red flags can be obsessive thinking. So many times patients come to us and they are reporting whenever they are fasting, so they always have the food thoughts. They always think about like what they have to eat, if they are continuously checking the healthy outcome and their weights as well. So this obsessional thinking become a repetitive pattern